C-reactive protein, CRP, is a key marker used in blood tests to assess inflammation in the body. Elevated levels of CRP can indicate a wide range of medical conditions, from infections to chronic diseases, making it a valuable diagnostic tool. This video aims to explore the various reasons for increased C-reactive protein in blood tests, shedding light on the complexity of interpreting this marker. 1. Inflammation, a natural response. Inflammation is a natural response of the body to various challenges, such as infections, injuries, or chronic conditions. C-reactive protein is produced by the liver in response to inflammatory signals, primarily interleukin-6, IL-6, and plays a crucial role in the immune system's defense mechanism. It binds to foreign invaders and damaged cells, marking them for removal and enhancing the body's ability to fight off threats. This defense mechanism often leads to increased CRP levels in the blood, making it a reliable marker for inflammation. 2. Acute infections. One of the most common causes of elevated C-reactive protein levels in blood tests is acute infections. When the body encounters bacteria, viruses, or other pathogens, it triggers an immune response. The immune system releases IL-6, stimulating the liver to produce CRP. The higher the infection severity, the more CRP is produced. In these cases, elevated CRP levels serve as an early warning sign of infection, helping doctors diagnose and treat the underlying cause. 3. Chronic infections. Chronic infections, such as tuberculosis or viral hepatitis, can also lead to elevated CRP levels. These conditions may not provoke as pronounced an immune response as acute infections, but the constant presence of pathogens in the body keeps CRP levels consistently elevated. Monitoring CRP levels in individuals with chronic infections helps gauge the effectiveness of treatment and assess disease progression. 4. Inflammatory conditions. Various inflammatory conditions, including autoimmune diseases like rheumatoid arthritis and systemic lupus erythematosus, can cause a persistent increase in CRP levels. These conditions are characterized by the immune system attacking healthy tissues, leading to ongoing inflammation. High CRP levels in these cases help in monitoring disease activity and guiding treatment decisions. 5. Tissue damage and trauma. Not all elevations in CRP are solely due to infections or inflammation. Tissue damage and trauma, such as burns, surgeries, or muscle injuries, can also cause an increase in CRP levels. Even though these events are not driven by infection, the body recognizes the need for repair and activates the immune system. This immune response, triggered by the trauma itself, results in increased CRP production. 6. Cardiovascular disease. Elevated C-reactive protein levels have also been associated with an increased risk of cardiovascular diseases. Atherosclerosis, the buildup of fatty plaques in the arteries, is a key factor in cardiovascular diseases like heart attacks and strokes. Inflammation plays a critical role in the development and progression of atherosclerosis. As a result, CRP levels can rise in response to arterial inflammation and may serve as a marker for cardiovascular risk. High-sensitivity CRP, HSCRP, tests can measure CRP levels more accurately in this context. 7. Metabolic syndrome and obesity. Metabolic syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. These conditions include obesity, high blood pressure, high blood sugar, and abnormal cholesterol levels. Obesity, in particular, is known to contribute to chronic inflammation in the body. As a result, individuals with metabolic syndrome or obesity often have elevated CRP levels, reflecting the ongoing low-grade inflammation associated with these conditions. 8. Chronic respiratory diseases. Chronic respiratory conditions, such as chronic obstructive pulmonary disease, COPD, and asthma, can also cause increased CRP levels. Inflammation of the airways and lung tissue is a hallmark of these diseases, and CRP is produced in response to this inflammation. Monitoring CRP levels in individuals with respiratory diseases can help assess the severity of inflammation and guide treatment. 9. Gastrointestinal disorders. Inflammatory bowel diseases, IBD, including Crohn's disease and ulcerative colitis, are characterized by chronic inflammation in the gastrointestinal tract. This inflammation can lead to an increase in CRP levels in the blood. CRP is used not only for diagnosing IBD but also for monitoring disease activity and treatment effectiveness. 10. Cancer. Cancer is another condition associated with elevated C-reactive protein levels. Tumor cells can release substances that trigger inflammation in the body. Additionally, the body's immune response to cancer can lead to increased CRP production. Monitoring CRP levels can be valuable in assessing the inflammatory response to cancer and its impact on overall health.
11. Medications. Certain medications, such as corticosteroids and non-steroidal anti-inflammatory drugs, NSAIDs, can influence CRP levels. Corticosteroids are used to treat various inflammatory conditions, and their suppressive effect on the immune system can reduce CRP levels. Conversely, NSAIDs, commonly used to relieve pain and inflammation, can lead to higher CRP levels. It is important to consider medication use when interpreting CRP results. 12. Lifestyle factors. Lifestyle factors also play a significant role in CRP levels. Smoking and excessive alcohol consumption can lead to chronic inflammation in the body, resulting in elevated CRP levels. Conversely, adopting a healthy lifestyle that includes regular exercise and a balanced diet can help reduce inflammation and lower CRP levels. 13. Aging. It is worth noting that CRP levels tend to increase with age. This age-related increase is partly due to the gradual accumulation of inflammation over a lifetime. While elevated CRP levels in older individuals are not necessarily indicative of a specific health problem, they may be associated with a higher risk of age-related diseases, such as cardiovascular disease and certain cancers. 14. Pregnancy. During pregnancy, CRP levels can be elevated as a result of the body's natural immune changes. The maternal immune system is modulated to accommodate the growing fetus, and this can lead to a slight increase in CRP levels. In this context, elevated CRP levels are not indicative of pathology and are generally considered normal during pregnancy.
Elevated C-reactive protein levels in blood tests can have various underlying causes, ranging from acute infections to chronic diseases, tissue damage, and lifestyle factors. This marker serves as a valuable tool for healthcare providers in diagnosing and monitoring a wide array of medical conditions. Understanding the complexity of interpreting CRP results is essential, as it allows for a more accurate assessment of a patient's health status and helps guide treatment decisions. It is important to consider the clinical context and other diagnostic information when interpreting CRP levels, as a single elevated result may not always indicate a serious health issue. In many cases, CRP levels are just one piece of the puzzle in the broader context of a patient's health. Thanks for watching. Please subscribe to our channel for more useful videos for nurses. Also, detailed article on this topic can be found at www.Nurseshere.com.